Miracle, how are you today?
Yeah, I'm great. I'm awesome. It's good to be here.
I'm always happy to have you on my set.
I'm excited to be on the show, man.
Hope you're about to give us hot like you did last week.
I'm about to give you cold.
Right. What about you, Dr. Shinowo? How are you?
I'm fine.
Hope it didn't stress you when you were coming here.
You know, it's Lagos now, so...
And your Sunday has been good?
Yeah, so far.
Okay, cool.
It's about to get better.
Over to my beautiful audience. How are you guys today? Hope you've had a lovely Sunday. It's the show Unbroken, where we bring everything mental health. We share real life stories and share tips and ways to manage your mental health. Today, we'll be talking about the relationship between physical illness and mental illnesses. My name is Choma. I'm your host, and welcome. So studies show that there is a huge relationship between chronic illnesses and mental illnesses. In fact, it says that there are some sort of chronic illnesses that, you're very susceptible to mental illnesses. And I always bring it to you guys as real as possible. So with me, I have, again, two lovely guests who are professionals in their field. First of all, I would say my new favorite, maybe my new bestie. He's a specialist, a resident specialist and clinical psychologist, Miracle Ihoma. Welcome.
Thank you.
Always welcome.
Yeah.
Yeah, and I have somebody that is very important. In fact, I'm not even worthy to be on this set since he's on this set too as well. He is Dr. Shinowo. He is a primary surgeon who has been doing wonderful in his field and making impact. So I'll just allow him to just tell us something, brief, just to give us a brief insight on all the things that he has been doing. So how are you, Dr. Shinowo?
I'm fine, thank you.
So a little bit told me that you've actually been giving free surgery. So can you just tell us what that is about and how many have you done and how long have you been doing it?
Yeah, it's just my way of giving back to the society every year. I do it at the end of the year. So I pick people who cannot afford to pay for their surgeries, and then I do their surgeries 100% free.
So how many have you done?
So far, I started 2016. So far, I've done close to 1,200 people.
Wow. Wow, guys. So you'd agree with me that I have two people who can actually do justice to this conversation today. So right now, we'll be watching a short clip of a young woman who is suffering, an illness and is also dealing with her mental health too as well. And when we come back, our phone lines will be open for conversations.
I'm a final year student and I'm also a chef. My mom died when I was really young. I'm not sure I remember the exact age. From age 0 to age 17, I enjoyed my better part of life because I still had my dad and then I had a loving family. But after the passing of my dad, life didn't seem like what I wanted anymore. It's like from trouble to trouble, and I was always falling sick. The fact that there's no father to cater for me anymore was really depressing. And then I had a brother who was never available. Unfortunately, he passed on too. After I lost my brother, everybody thought I was fine, but I wasn't. At the cemetery, I wanted to stay back with him. I didn't believe he was dead. I'm sorry. I still think he's not dead. I still feel a part of me and him still talk in my dreams. I was depressed. I just wanted to die. Because if I die, I'll join them. I will be happy together. I'll be with my mom, my dad, and then my brother. Then I went to the counseling unit. And I told them, if this unit of this university works, I want to drop out. I can't study anymore. Whatever I'm reading is not going into my head. I will have poor grades and you will withdraw me. I want to stop. I can't study anymore. They asked when last I slept. I said I couldn't sleep. I've not slept in 6 days. Because at night, instead of me to sleep, I would cry. I read the Bible. and cry. I wake up the next day, bathe, and I just felt everything was fine. I was dizzy, but I just felt everything was fine. If this could make me die, I wanted to die. I didn't mind the consequence. I wasn't having crisis on a normal day. If you don't sleep, for a sickle cell patient, if you don't sleep, you die. Because you need to sleep, your blood needs to rest. I just thought I was going to die, and they looked at me and they called on to Luth, Lagos State Teaching Hospital, the psychiatric department, and they called them and told them that they had someone for them, the suicide prevention unit. So those ones were on standby. I didn't know any of this was happening. I just told them what I felt like, and then they said, okay. And I got up and I thought I could leave. Only for me to be surrounded by doctors. I was like, okay, am I in any trouble? They said, no, they just want me to come with them. For sickle cell, mental breakdowns are often. They are very often. You'd have anger problems. Flashes come to your mind that you are going to die. I'm going to be 30 in November, and every 13th of every month, it comes to my mind that what if you don't get that month? It scares me. Men broke up with me. I have friends who have left me, female friends who left me. I have men who said, oh, I don't want to marry someone who's going to die. In the guy's voice, I don't want to marry an abiku. Some men even see sickle cell patients as an abiku. I once dated someone. We dated for 4 years. He was AA. He promised he was going to marry me. He knew about my genotype. On the 4th year, which is supposed to be last year, he got married. He didn't even tell me anything. And when I got to eventually hear from him again, it had to do with my genotype. That I don't want to give birth to children who will come to the world and start dying. But I attempted suicide. When you think of suicide, it's like this black empty room. You see yourself, the substance that's going to help, and freedom. You just see it as a path to end that pain. If I do this, I'm going to be free. For those who are also dealing with sickle cell, please be strong out there. I didn't mean to come out to say this, but the truth is it won't stop. Stay strong, eat healthy. Don't marry because of love. Please, I beg you, don't marry because of love. I'm sure my dad married my mom out of love, and then here I am dealing with SC. Please don't stigmatize mental health. Please don't stigmatize any health at all. You would never know how it feels until you're in the shoes of that person. I'm a chef, I'm a single mother, I'm a student, and I'm a sickle cell warrior. And I am unbroken.
Welcome back, everyone. That story sends shivers down my spine. Every single time I watch it, I cry. I was the one who interviewed her, and the same emotions I felt then is the same way I feel right now, hearing a young lady having to go through all that. So before I start, just to allow me ease off, my beautiful guest, Miracle, what did you think about that story? I just want to hear, what your thoughts are on that story.
Wow. Wow. It was an emotional one. Really, really emotional because, she didn't decide, and of course that's one of the things, the tragedies of life, that many times, many of the mayhems and the things we actually get to experience, the things we get to experience in life are things not chosen by us.
Yeah.
Right? They are actually the choices of our handlers, right? And it's really a sad one, and that's why I tell people, I know a lot of people say, oh, I love this person, I have a lot of faith that this is even going to change. I would rather, that faith works before you get married.
Exactly, exactly.
Than hope that it's going to work in marriage.
Exactly.
Really. Because what if it doesn't work?
Yeah.
You put the life of
somebody else
at
Very
risk,
true.
sometimes for the rest of their life. they never get to be the same anymore. Just like this young lady going through all of this. So it's really a pathetic one.
Okay, what about you, Doctor?
Yeah,
How do
I
you
feel
feel?
exactly the same way he does, you know. The cards life dealt her were not good ones. And it could have been prevented, you know, from what she was saying. She stylishly blamed her parents for the whole thing. So,
and I think what makes it even harder is that right even in the middle of the whole thing, she now lost her support system. So she doesn't even have family, and then she's dealing with, you know, being sickle cell as well.
The thing about things like this is it's a positive feedback.
Yeah.
The condition she has gives her symptoms that will make the conditions itself worse.
Exactly.
So it just keeps, it's a loop.
Yeah.
You know, she has very strong mental tension, so to speak, which can in turn manifest physically and give her crises and stuff, which will in turn make the mental condition
so
worse.
It's just a ripple effect. It just keeps going and coming and going. It's just a cycle. So right now our phone lines are open, and you can make comments or reach out to us to ask questions. Call us on 090-8764-3339, and you can also tweet at us at Views Channel 108. And you can watch live too as well on Instagram, Views Channel 108, or Facebook and YouTube, Views Channel. So this is always my best part of the show, where I ask all the questions and you guys get to answer all my questions. Like, it's so good being a host because I just dash it with all the work and then you have to do it for me. So again, I think Doctor already mentioned it, which is that the condition, you know, triggered her mental state. But I'll pose this question to you. With the story you heard, what are the different mental issues that you feel like she must have gotten, you know, from the situation that she was on? I know she kept on saying things like suicide and all that, but I'm sure there are some other things that you feel like might have come out from this situation. Again, this show is not to tell you that you have a problem. We're just discussing. So don't take any of this as an assessment saying that you have this or you have that. This is just to educate you. So please, what do you think?
Okay, there are quite a number of mental health or risk that people with sickle cell and maybe other even chronic illnesses have tendencies, you know, of having. Depression is always at the forefront because you are, so imagine somebody, for instance, whose legs has to be or had to be amputated, you know, because of a condition, and then you're somebody who have worked for say 30 years of your life, and then here your legs are no more, and then you have to live the next 30 years of your life without legs.
Yeah.
You know, if you were born with legs, it's different. If you were born without legs, it's different from you were born with legs. You had experienced what it is to have legs, and now you have no legs. So that puts you in a state of low mood, and of course depression, right? So depression is usually at the forefront of things like this. A lot of people with sickle cell anemia, you know, usually have at the risk of having depression. Anxiety is another one as well, you know, where they are always anxious, you know, just like he said, because they have had certain crises at certain points in their life. Sometimes they expect it, right? And that puts them in a state of anxiety.
I remember she said something that every 13th of December she's remembering, am I going to die?
Yeah, am I going to die? So that gets her anxious, you know, at a point, you know. So there are many others, you know, the people with chronic illnesses like that, even at the risk of having bipolar, you know, disorder, and many other illnesses that, you know, they could be at the risk of having because of that particular illness that they have. You know, like I tell people, physiology affects psychology and psychology affects physiology.
Let me just bust your head right now. Do you know that today is 13th of December?
Wow.
Wow.
That's true.
Okay. So I'll move to you. We'll still talk about all the mental illnesses and go into the intricates, but I'll move to you, Doctor. So as I said, you know, it's been proven that there is a link between mental illnesses and, you know, chronic illnesses. Why do you think that this link exists? Why do you think that if someone might be affected by a chronic illness, chances are that they might also develop a mental illness as well?
Okay. I'll put it this way. There is one thing that the body cannot cope with for a particular amount of time. Once you exceed that, the limit differs for individuals. Once that limit is exceeded, you will do anything, and that is discomfort. No matter how educated, exposed, or strong a person is, if the person experiences pain or discomfort in any form for a particular amount of time, that person will do anything that is not in keeping with the person's level of education. That's why you see professors of medicine going to use herbs. You understand what I'm saying?
Yeah.
So let me explain something. You know, the sickle cell thing is like a group of disorders of hemoglobin. There are different types. The hemoglobin SS is the most common and the most severe. In Africa, I think this in sub-Saharan Africa, like Congo, Ghana, Nigeria, we have like 20 to 30% prevalence. The Ugandans are they have a worse case. Theirs is like 45%.
Oh, wow.
You understand what I'm saying? So it's a problem. The blood is life.
Yeah.
It is the blood that transports oxygen, that breaks down the food you eat to provide the energy needed for your body to function. So the part of the blood that carries that oxygen is the red blood cell. And the part of the red blood cell that really transports the oxygen is the hemoglobin. Now, sickle cell is a problem with hemoglobin. So if there's a problem with your hemoglobin, you can't transport oxygen. Do you know what that means?
Shortage,
you know, when you work out for long, oxygen does not get to your muscles as much as you can imagine the kind of pain you feel, cramps and everything.
Exactly.
Now imagine feeling those kind of pain
Regularly.
in a more severe, at a more severe intensity, without even working out in all your organs.
Guys,
because blood does not get to even the brain.
This is why we have someone like this, because right now it seems like I'm just in some biology class where I'm being
just
explained.
trying to make it simple.
Yes.
So just imagine a human being not having oxygen delivered to every part of his body in constant pain right from infancy.
Wow.
Because the symptoms start to manifest as from 6 months. There's something they call fetal hemoglobin. Fetal means fetus. You know, that's the hemoglobin that you come out with from your mother. It's protected. It is the best form of hemoglobin you can find. The oxygen carrying capacity is very nice. But after 6 months, you lose that fetal hemoglobin. So you then change to whether it is the normal AA or the sickle one you have. So what sickle cell actually means is the shape of the red blood cells are abnormal, sickle. And once they sickle, they block blood vessels. So depending on what happens, you understand, the symptoms that will manifest differs depending on the age and the condition that person is exposed to. There are some they experience during infancy. You know, that's where you see their hands and feet getting swollen because the blood vessels to the hand has been blocked by the abnormal sickling. Even the younger people are more prone to stroke when the blood vessels to the brain get blocked. You understand what I'm saying? So during their teenage years, they have what they call acute chest syndrome, when blood vessels get blocked somewhere around the chest. You understand what I'm saying? So it differs. So imagine being in pain from infancy.
How it's
and knowing that your life expectancy is between 42 to 47 years.
Wow.
Like this lady, I can pick out nothing less than 5, let me say, broad mental health issues. She has, like he said, depression. She has a phobia. She has phobia for different things. She doesn't even know what or what not to do because she does not want to have a crisis. She has post-traumatic stress disorder.
Exactly.
She lost her brother every December 13th.
Yes,
she keeps remembering. That's PTSD, post-traumatic stress disorder.
Very true.
You understand? She has some form of psychosis.
Yeah, she actually mentioned that too as well.
She's violent. She has bad interpersonal relationships. The guy might probably not even jilt her, let me use that word, because she is SS. No. He probably could not stand her anymore. Yeah. Because from what even she admitted that she was hostile.
Yes, very true. Okay, thank you so much, Doctor. Thank you. See, this show always, every time I listen to my guests speak, right, there's always so much information that I get to have from this show. And I'm very glad, I'm very grateful that they're always here with me. So guys, again, the phone lines are still open. You can reach out to us on 0908 7644 4339. Yes, and you can tweet at us at Views Channel 108 and still watch live on Instagram, Views Channel 108, and Facebook and YouTube, Views Channel. So, I still have more questions to ask. Okay, so I already asked you about the mental illnesses that she might have developed, but I would want us to just go into the intricacies. But one thing that was very remarkable for me was her suicidal ideation. Again, there's still PTSD, which is what we discussed last week. What are some of the symptoms that you think someone who is suffering from suicidal ideation might exhibit, you know, when they have suicidal behaviors or suicidal ideation?
Okay, suicidal ideation is actually, it's like a sequence, right? And of course, suicide starts with ideation, right? Ends with suicidal
Behavior.
actual suicide,
yeah.
right? So anyone with suicidal ideation, most likely, most time, is suffering from depression.
Yeah.
You know, depression always precedes suicidal ideation or suicide, right? And what precedes depression is hopelessness. What is depression? Depression is a feeling of worthlessness and hopelessness, right?
Persistence.
Yes. So when I tell people that cluelessness precedes hopelessness, why hopelessness precedes depression, and depression precedes suicidal ideation, and suicidal ideation precedes suicidal attempt, right? And then suicidal attempt precedes suicidal completion, because not everybody who has suicidal ideation actually attempts to commit suicide.
Yeah, exactly.
A lot more people have suicidal ideation than that don't attempt to commit suicide. Why a lot more people attempt suicide than people who actually complete the action of committing suicide, right? So before one gets to that point, like I said earlier, it starts from a point of cluelessness. And what is cluelessness? Cluelessness is you get to a point where you don't know what else to do. You feel like there are no more options, right? And that's why people who are suffering from depression have what is called a dichotomous mindset, right? What that means is that they see life from just two perspectives only, white or black,
no shades of gray.
Or that, right? So it's either I get married or nothing else, I die. It's either I become rich or nothing. It's either I go to University of Lagos or there's no other school. I heard of the story of a lady, one time who committed suicide because she failed jump. It was so humorous. I was like, you really?
But we don't even understand.
As that was, it was. Because come on, you failed jam and committed suicide.
Okay,
why
sorry, Miracle. We have a call right now. Sorry, so please just hold that
fine.
thought. Hi, caller. How are you? And what's your name and where are you calling from?
Good afternoon. My name is Demola.
Hi, Demola. How are you today?
I'm very fine, thank you.
So, do you have a question or do you want to make a comment?
Oh no, just more like a motivation.
Okay.
Because I saw the video and the one story is really, really, really touching. And I can't imagine what she's going through. I mean, apart from her being SS, with everything she mentioned, every December 13th, this occurrence, this PTSD she's always having, it's too. I think it's too much for one person to handle.
Okay.
I really hope and I pray for her that she can get through this. But she said she has a child already, so hopefully her child is not, SS or any of those.
Yeah.
Try as much as possible to talk to people, as in talk to professionals when we have issues like this.
Yes.
Because for people like us, sometimes when we have when we're sick, we probably go to Google and we go and start Googling our symptoms. And I think Google itself has a lot of things that affect our psyche. Because when you start seeing some symptoms of things that, you think you have, then you now start having the symptoms. I'm like, I think it's brain tumor. You now start having headache or regularly and stuff like that. So I think as much as possible, we should try to, take care of our bodies, then probably talk to professionals and stuff like that.
Yeah. Very true, very true. Thank you so much for that comment. Thank you very much. Okay, so you were speaking, just so we round up on depression, because we'll have more episodes where we actually in depth on depression, because it's something that, you know, that's everybody, you know, when you say mental health, the first thing people think about is depression and anxiety. So we actually have an episode on that.
But one of the things, you know, that we need to be careful of, like you said earlier, is actually stigmatizing people and labeling people. Right, which is why I'm not so even quick to even label the lady, right? It's like trying to say things like she has this and she has that, right?
Yeah.
Labeling is one of the reasons even people get into even more mental health problems.
And the stigma.
Because when you look at somebody and then you say this person has, you have sometimes even without proper analysis and assessment, you know, and that's why we insist that, okay, fine, let's do a proper assessment first. To be sure, even if you come to me and I know that you most likely have PTSD, you most likely have depression, I'll still tell you, okay, let's do a proper assessment, you know, to consolidate, you know, that. If not, you would just be assuming, because you might just be wrong.
Exactly.
You know, because there are a lot of comorbidities when it comes to mental health illness, right? One might be having another mental illness primarily, but comorbid depression. Comorbid is having maybe alongside, you know, by the way you get. So that's why it's very important that we don't, you know, label people and make them. And that's why I tell people, don't, and if you're listening to me out there, please listen to me well. Don't ever you call anybody mad, right? It's a demeaning thing to call people like he's mad, he's insane. You know, that mad guy, that guy's mad. No, it's a demeaning thing to say. I know a lot of people say, but he's mad. Now what else should I call him? But then, if you say that, then you don't understand the power of vocabularies. You don't understand it, right? Because there are many things that mean the same, but convey different potency in their communication. Let me give you an instance. So if I say, for instance, I am peeved, and I say I am enraged or I'm angry, they are the same thing basically, but they convey the different intensities. If I use the F word and if I say sex, they are the same thing, but they convey different intensities. So that is how powerful vocabularies are, and that is how much we should be careful when, you know, talking to other people and trying to label them. So if you see somebody who might have any mental illness or mental health disorder, what you want to say is, oh, this person has a mental illness, he has a mental health condition, a mental health disorder. That's a better way. It's more humane to talk to people that way than saying that he's insane, he's mad, and all of that.
Or a retard.
Yeah.
Guys, it's only on this show that you speak about mental health and still learn English. Don't I have wonderful guests? So you guys have learned one now, peeved and rage, Abby. I just learned that one too as well. So we're going on a short break, and when we come back, we'll continue our conversations.
I'm a final year student, and I'm also a chef. My mom died when I was really young. I'm not sure I remember the exact age. From age 0 to age 17, I enjoyed my better part of life because I still had my dad, and then I had a loving family. But after the passing of my dad, life didn't seem like what I wanted anymore. It seemed like from trouble to trouble, and I was always falling sick. The fact that there's no father to cater for me anymore was really depressing. And then I had a brother who was never available. Unfortunately, he passed on too. After I lost my brother, everybody thought I was fine, but I wasn't. At the cemetery, I wanted to stay back with him. I didn't believe he was dead. I'm sorry. I still think he's not dead. I still feel a part of me and him still talk in my dreams. I was depressed. I just wanted to die. Because if I die, I'll join them. I will be happy together. I'll be with my mom, my dad, and then my brother. Then I went to the counseling unit. And I told them, if this unit of this university works, I want to drop out. I can't study anymore. Whatever I'm reading is not going into my head. I will have poor grades and you will withdraw me. I want to stop. I can't study anymore. They asked when last I slept. I said I couldn't sleep. I've not slept in 6 days. Because at night, instead of me to sleep, I would cry. I read the Bible, I cry. I wake up the next day, bathe, and I just felt everything was fine. I was dizzy, but I just felt everything was fine. If this could make me die, I wanted to die. I didn't mind the consequence. I wasn't having crisis on a normal day. If you don't sleep, for a sickle cell patient, if you don't sleep, you die. Because you need to sleep, your blood needs to rest. I just thought I was going to die, and they looked at me and they called on to Luth, Lagos State Teaching Hospital, the psychiatric department, and they called them and told them that they had someone for them, the suicide prevention unit. So those ones were on standby. I didn't know any of this was happening. I just told them what I felt like, and then they said, okay. And I got up and I thought I could leave. Only for me to be surrounded by doctors. I was like, okay, am I in any trouble? They said, no, they just want me to come with them. For sickle cell, mental breakdowns are often. They are very often. You'd have anger problems. Flashes come to your mind that you are going to die. I'm going to be 30 in November, and every 13th of every month, it comes to my mind that what if you don't get that month? It scares me. Men broke up with me. I have friends who have left me, female friends who left me. I have men who said, oh, I don't want to marry someone who's going to die. In the guy's voice, I don't want to marry an abiku. Some men even see sickle cell patients as an abiku. I once dated someone. We dated for 4 years. He was AA. He promised he was going to marry me. He knew about my genotype. On the 4th year, which is supposed to be last year, he got married. He didn't even tell me anything. And when I got to eventually hear from him again, it had to do with my genotype. That I don't want to give birth to children who will come to the world and start dying. But I attempted suicide. When you think of suicide, it's like this black empty room. You see yourself, the substance that's going to help, and freedom. You just see it as a path to end that pain. If I do this, I'm going to be free. For those who are also dealing with sickle cell, please be strong out there. I didn't mean to come out to say this, but the truth is, it won't stop. Stay strong, eat healthy. Don't marry because of love. Please, I beg you, don't marry because of love. I'm sure my dad married my mom out of love, and then here I am, dealing with SC. Please don't stigmatize mental health. Please don't stigmatize any health at all. You would never know how it feels until you're in the shoes of that person. I'm a chef, I'm a single mother, I'm a student, and I'm a sickle cell warrior. And I am unbroken.
Welcome back, everyone. We just saw a short clip, which we had watched earlier, about the young lady who is suffering from sickle cell disease and is also having to deal with a mental illness. And here in the studio, I've had very beautiful discussions with my guests, which I'm very, very happy about. You know, from learning about mental illnesses to learning about sickle cell, and also learning English, the only show that gives you 3 in 1. So
That makes you laugh as well.
I know, so we're bringing it the whole 9 yards, guys. So I'll just, Doctor, you know, I like when you give me all these your answers, because I'm learning a lot from it. Miracle is my guy. He's always here on the show every week. So right now I'm putting the spotlight on you, and I know Miracle is okay with it. So right now I'd just like to talk about labeling. And Miracle just touched something on it when he spoke earlier. You know, she said how people tagged her Abiku, sorry guys, I'm Igbo, manage, you know, and called her names because of her status. So why do you think people actually attach or label, people? Why do you think people do that? And it's not just in her situation, I think generally.
From my years of practice, I think it's the way we create awareness that leads to, that backfires as labeling. Let me give an example or illustrate with HIV. Then when people want to say that, that meaning a disease that doesn't have a cure, God will not let us contact it or contract it too. So when someone hears that this person has HIV, the person's mind will just flash back to the, jingles and everything, that disease without a cure. It's the way we create awareness at times that leads to it just backfires. It's like a rebound thing from the stigmatization.
And I think that's why even like these are conversations where we need to begin to change narrations of things. And just as you spoke, so saying things like, instead of saying mad, we're actively telling people, start to change the words. Instead of saying some people, when they're sad, they say they're depressed. I find that so sometimes really annoying, because I'm like, if you understand depression, you would not say you're depressed, or people who are OCD, they say they are neat freaks, and then they call themselves OCD, and there's just a whole lot of words around that. And yes, I agree with you. The narrative, the way we actually tell these stories needs to be changed. So over to you, Miracle. What do you think, or how do you think someone who has a chronic illness can also manage their mental health?
All right, thank you for that question. How I think one who has a chronic illness can manage their mental health. One thing we need to know is there are things we can change, right? There are things we can't change. So what I tell people is, when you're faced with something you can't change, change it. If you're faced with something you can't change how you see it, right? Because that's the only thing you can do, right? You can't change the situation. There's nothing you can do about it. So for instance, if you have sickle cell anemia, there is absolutely nothing you can do about it. Except, of course, God, honors my name, a miracle, and then gives you a miracle. If not, you will live with it throughout life. But then you already have one condition. Why have two conditions when you can just live with just one? So why now go ahead to have depression alongside sickle cell anemia, or anxiety, alongside sickle cell anemia? One is enough, right? So you need to now change, which is the purpose of therapy actually. What we do things like CBT to help you now develop a new meaning, right? From whatever it is you are going through. And really, like what I tell people, there is something good in every bad thing. There's something good. You just need to change, pause for a moment, and then take a second look from a vintage point. You would see that there's actually something good about everything. Be it a chronic illness, be it rape, I know that sounds weird, be it poverty, be it whatever it is, there's always something good about it. And until you begin to see the good thing in the bad thing, you will not get to appreciate that condition, and then you will not get to live the best of your life, actually, because you will keep rigmaroling in the pitifulness of that particular condition, and all you would do is to keep living in pity and then absorb the pity of other people. But the day you now see them and say, okay, fine, I have this condition, there's nothing I can do about it, but how can I see this differently? What's a blessing in this condition? Because there's a blessing in it. I was speaking during the break, I was speaking about a woman who I know personally. At least I've spoken for her, on different platforms. Even she invited me on a radio show multiple times, right? And one of the things she does is to actually help. She's a victim of sickle cell as well. She's living with sickle cell, but she's actually gone ahead to help other people who are living with the same condition.
Very true. So basically, we're just saying at this point, let's figure out how we can turn the story around, and heal too as well. It's very important to heal. It's very important to heal. So right now we're rounding up the show, but I would like to hear your closing remarks, just because we always want to leave our audience with something to go home with. So please, Doctor, share with us the last things you'd like to tell our audience before you leave.
Well, nothing much. Like he said, if you get dealt a very bad hand, you just see what you can make out of it, and God willing to
turn the story around. What about you, Miracle?
All right. there are a couple of things jamming in my head, but I would say that, just like she said something very important, that got me thinking. You don't marry for love. That got me thinking, And then I read of somebody very renowned, I've forgotten his name right now, who said, no matter the kind of mistake you make in this life, never marry for love. And I was perplexed, And he said he got married to somebody about 13 years older than he was, But I got to understand what he meant, We don't marry for love, even though we love who we marry, right? But that should not be. So when I tell people, for instance, that going into a relationship or going into marriage just because you love somebody is not enough, they think, I'm joking. So take this as a case in point where you are both SS, but then you are looking at the greater good. Come on, we are not physically compatible. Because when we talk about marriage, one of the things you want to look at, even relationships, is compatibility. Because there's about 7 areas of compatibility. This is a relationship show, but don't let me go into that. But one important area of compatibility is physical compatibility. You want to look at, am I compatible with this person physically? And when I say physical compatibility, one of the factors of physical compatibility is attraction. Another one is your medical records. Taking
your blood test, genotype, everything
as a case study.
Very
so
true.
It's very important that we pay attention to it,
Very
so that we don't keep making innocent children to keep suffering.
Very true. Very true. Thank you so much. Thank you. Guys, you heard it first here. Our philosopher, English teacher, doctor, psychologist, comedians, everything all in one, right on this show, Unbroken. It's such a privilege to have you guys. Thank you so much, Miracle, for always honoring my invitation. And thank you to Doctor for taking our time in your busy schedule to actually answer me and to honor us too as well. I'm so grateful to have you guys on this show. Thank you so much.
Thank you.
And to my beautiful audience, who I'm sure are very beautiful and are listening to me as well, I'm so grateful that you're on this show today. First of all, you can reach out to us if you know you want to come on this show and you want to share your story. You can actually remain anonymous too as well, even though you don't want people to see you, because guess what, this show is about letting the world know everything mental health. So if we begin these conversations, we'll be able to spread the word and people will be comfortable to come out about their mental state. So if you need help, you can email us, Olama Cares Foundation, support@olamacares.com, or send us, visit our website, www.olamacares.com. And aside that, you can also catch me next week for another beautiful episode where you can call in and ask all the questions that you wish to ask on Views channel, on Star Times, Views channel 108. And you can also watch on Instagram, Views channel 108, and Facebook and YouTube, Views channel. Thank you so much again for today. My name is Chioma, and you are Unbroken.